health, and more specifically chronic illness, is a taxing affair, both in terms of time and money. Providing care for a loved one often calls for major sacrifices that could dramatically change one's personal schedule and economic well-being. This is the struggle that inspired Dr. Rowena Njeri to establish Zoya Homecare, a company that offers personalized medical care in the comfort of your home.
Having worked in a community where I was dealing with a lot of elderly people, I realized and saw the struggle that such patients, especially older patients and patients with chronic illnesses, it's really a struggle coming to clinics for reviews by consultants. And I just thought that it would be much more convenient to have the service brought to them. And also the issue of healing. So being in your own environment with people you love and not in cold hospital rooms, research has shown that it improves the outcome for patients better than in hospitals. Recovery is better. So with that knowledge, I was inspired to start a service that I know is not easily available in Kenya.
Zoya provides a doctor for general review, gives recommendation, and a treatment plan is drawn up. Thereafter, the caregiver signs their consent form, a deposit is made, and medical care commences.
The difference between home care and hospital care is the patient and their family, the care is customized to what is convenient for them. But we also, within reason, within the standard medical practices. So we don't overly bend and then go outside the medical rules, because of course there's rules to how healthcare should be provided.
The market reception for the product has been good, according to Dr. Rowena. But the major challenge lies in the cost of providing quality medical care, which is still beyond the reach of many.
Right now, Kenyans are struggling with the economy. So that's the biggest challenge. So you only target a certain market because it's cash basis. Good drugs are expensive, services are expensive. When you have a market that there's such few healthcare providers, then of course the market rates are high. And then those are costs that we have to incur as a company, and unfortunately they're offloaded to the patient.
For clients such as Gideon, the cost of providing home-based care is more manageable compared to being attended to in a hospital.
Mom has been sick for almost 3 years now, starting from ICU for 3 months, and then moving from where she was in hospital to home, then back again to ICU, and then finally now we are here with her at home. Now my experience has been that during that period in hospital, we did get very good care. But again, our life came to a stop because most of the times it meant that I couldn't be able to go to work, or one of our family members had to be with her. The home care's nursing and medical services are more cost effective in comparison to what you'd get in a hospital. It's a one-to-one care, for basic daily activities for the patient, and we feel more comfortable with that. There's also a lot of consistency in terms of the nurse that we have. We have the same person looking at the same patient all the time, so again that helps a lot. The experience in hospital was not very good, especially during the ICU period, where we ended up with bed sores because the patient was in a coma and there was no good care, so she wasn't being turned in good time. So we ended up with something that we didn't go in with. So home care, we can take care of some of those little issues, and we're able to really provide that homely feel, and also the family is fully involved with her cure and healing period.
That notwithstanding, Gideon says more needs to be done to ensure a vibrant and functional health system in the country.
It might be an issue of, like our personal experience was misdiagnosis. When you go to the small dispensaries, small hospitals, they don't have the equipment to be able to really diagnose what is the problem. My mom started with the first diagnosis of amoeba. Then after taking medication for over a week and she was in more pain, we realized there was much more to it than just amoeba. So went back and they found out that it was intestinal obstruction. So it required a surgery and that could be undertaken there. So we had to move from the little town to Mombasa, where she had multiple surgeries and ended up in a stroke and coma. But that could have been avoided. But so that basically what I'm saying is, I think we need to fund even the little dispensaries and county hospitals better, so that they're able to deal with some very basic diseases, have the right diagnosis and the right treatment at an early stage. Because I think that's the biggest challenge. If you don't get it right at the first stage, then it ends up being a bigger issue.
In the long run, both Dr. Rowena and Gideon hope that home care will not only be affordable, but accessible to as many Kenyans as possible.
The cost is really too high. Most people can't afford. It's a huge challenge. And even the ones who can, say, afford, they're really straining so much that they can't do what they would normally be doing. So at the end of the day, it really brings a lot of stress to the family in terms of both the emotional, physical, and financial. So I think the government could look at ways of subsidizing healthcare in ways that could become more affordable and accessible to a lot more people.
But we want to make services as efficient. So we're really working on involving a lot of tech in healthcare. It should be getting a nurse or a doctor should be as easy as at the touch of a button on your phone.
Care is thought to be affordable until a long-term, life-changing disease happens. The disease eats into your finances as you try to get quality health care, your time in and out of the hospital, visiting your loved one or as the patient, and finally drains you emotionally. This is what inspired Dr. Rowena to found Zoya Homecare, to allow patients to get quality health care at the comfort of their homes, surrounded by their loved ones. Through Zoya, people like Gideon have been able to go back to living their normal lives, going back to work, having a life, and also having their loved one at home, getting the health care that they need, and easing and quickening their recovery, since they're in an environment they're familiar with and surrounded by their loved ones. Dr. Rowena is this week's Trailblazer. My name is Ndero from Metropole TV.